Welcome to this Rethinking Anatomy video. In this video we're going to be covering the piriformis muscle, what it does, why that's maybe a little bit differently to what people generally think the muscle does, and what you can do to address it. Now, as soon as you hear the word piriformis, you're probably thinking things like sciatica, and that's because the muscle is in close proximity to the sciatic nerve. In some people, the nerve actually goes through the muscle and pierces it. In others, it goes under. But either way is that when this muscle becomes very tight or dysfunctional in some way, it can lead to sciatic pain. Therefore, as a trainer or therapist, if we can address this through exercise, it's a very good way of alleviating back pain in the entire lower limb. So, from an attachment site point of view, we have the sacrum here. And the origin of the piriformis muscle is on the anterior part of the sacrum. We have these 5 holes called the foramen, and in this, between the second, third and fourth, this anterior part here is where the piriformis typically attaches or originates. The second portion of this is the posterior aspect of the greater trochanter. So if we put these together, so if we put the hip back in the socket, is that what you'll see is that if this muscle was to contract, so it was the muscle that goes from here to here, we would get external rotation of the hip and some levels of abduction as well. So if we now put this into the gait mechanics, if we had the foot in contact with the floor and we were to abduct the hip and externally rotate it, it would be more towards this pushing off phase and directing the pelvis over to the other side, so that we're about to take a step with our right foot, this obviously being the left. But what you've got to ask yourself is a muscle of that size going to have the ability to lift up the pelvis and the entire trunk? Because around this region we have glute max, we have spinal erectors, we have hamstrings, and all these muscles have greater anatomical power, but also if we factor in momentum, the fact that we are walking at speed, which is a sense of controlled falling, is that the brain would not really have much usage in getting this stabilizer to contract in that manner. So if we're thinking about what it actually does, if we took it away from the situation, that's going to tell us its clinical relevance. So if we look at the swing phase of walking, so when we're swinging our leg like this, it's very important that we have our femur in a position of a slight external rotation, or it's able to externally rotate in order to place the foot in an ideal position to make ground contact with the ground. If the piriformis muscle wasn't there, as well as the deep stabilizer muscles above and below it, is that we'd have an issue with this re-external rotation process as our leg is moving through space. If we also have tension in the adductors, so we have too much internal rotation of the femur, we may land with our foot in a more internally rotated position, which isn't good for shock absorption. Therefore, the piriformis is more of a swing phase muscle, which allows us to externally rotate and abduct to get the foot into a more ideal position. So what's going on this side, we have to replicate that with our exercise selection. Therefore, if someone has quote unquote piriformis pain or a tight piriformis, think about why it might be overly tight, what's overworking, what's not working, but most of all, look at their strength during the swing phase of the gait, which is typically seen in more core exercises when they're either prone or supine. So if we want to work on the piriformis as a stabilizer muscle, we want to replicate a position where the client has to move that leg that we're trying to work on through space. So in other words, there's no ground contact. And that typically looks like a core exercise. So we're going to get a variation of the dead bug here, which is going to be working on the left piriformis. Now what you have to remember is that there'll be reasons why somebody's piriformis is tight. It will be trying to do the work that other muscles may not be doing, or it's overworking to compensate for other areas. So one of the things that you want to be considering is how we work as a whole unit, rather than just really trying to specifically work on one muscle. So in other words, when you do this exercise, they may not say, oh, I can really feel my piriformis or my glutes working. It'll more than likely show up in the path of least resistance, so where the client or patient is weakest. So what we're going to do is we're going to be working on this left hand side here, to the piriformis on this side. We're going to bend the knee like this and have just a the heel is pushed down into the ground. I just want you to put your hands up there for me, please. So pushing your knee and both hands are onto there like this. Now what you can do is put a prop behind the client's head so they're not excessively using the neck. They're going to push down here, bring this knee up slightly, and you can feel that engage through the midsection. Okay, so we have heel contact, knee contact, pushing down with the ball. Now what we're going to do is that this leg is going to be mimicking swinging through space, so it's going to come up like this and just hold in that position. Is that okay?
Yep.
And what can you feel working now? Core. And there's going to be a lot of core working. So to externally rotate and get the piriformis to contract, we'd need external rotation going in that direction. So all you're going to do is you're just going to say to the client, all I want you to do is imagine you're side footing a ball, push into my hand and breathe in. Breathing in, good, and out. Was that still core or is it going into the hips?
I'd say, yeah, it's coming across.
All through there.
The hip, yeah.
Good. And holding that position there, bring that leg down just a fraction there. I'm holding the leg to give it support, and you want to give the client the feeling that you can really feel their midsection working. So push down, stabilize through there. Breathe in and push your hand and push into there. So this is external rotation, which is what we want the piriformis to do, but we're getting it to co-contract. You can let that relax there. Co-contract where they're bracing their midsection, but there is no heel contact through there. Because remember, this is a muscle that isn't going to have primary focus or primary, it's not going to be working whilst the heel is in contact with the floor. It's more of a swing phase stabilizer. So if you think that this muscle is dysfunctional, or this person is really weak on one side but they're getting symptoms in the other side, that can be an indication that one side is tightening up to stabilize the sacrum because the other side's not doing its job. So if you have anybody with sciatic pain or lower back pain with sciatic symptoms, it's a really good drill to do just to see how they find it, and remember they may be a lot weaker on the opposing side. So just to reiterate, it's hands into the ball, stabilize through there, dead bug position, floating leg here. If they have a lot of hip flexor, so they feel the hip flexor working, just deload the leg yourself with the hand. They're going to breathe in, and as they breathe in, they're side footing there and they're getting that external rotation. Now, if the leg is too locked out, you may get a deduction, which is not what we really want. We need that bend like this. This is stable like so, and you're going to push your ankle into me and breathe in at the same time. And that really challenges the piriformis, which feels a little bit weaker in that side there. Yeah.